it is devastating to watch how this is playing out in the United States. We know that the President just earlier today predicted the next 2 weeks will be very painful for the country. From the modelling, from the projections, just how bad is it expected to get there?
Yes, well, Ashley, we're talking about some 100,000 to 248,000 deaths, and that is a far cry from what we heard from the president earlier this month, talking about how it would be just one person from China and then it would just magically disappear. That is not what's happening here in the U.S., and we knew that once we had this White House coronavirus task force with doctors like Dr. Anthony Fauci, Dr. Birx, who were saying that this is something that you have to get ahead of. The best tool that we can use right now is social distancing, and they were advocating for those guidelines. So initially here in the U.S., President Trump had those guidelines for 15 days. That has now been extended for another 30 days. So President Trump saying that this would all be wrapped up. Hopefully people would be back to work and back to school and business as normal in the U.S. by Easter was a very optimistic outlook, but none of the health professionals really backed up that claim. So here we are, based in science, knowing that we have yet to reach the peak here in the U.S., and we're seeing the epicenter right now in New York City. Officials believe that the coronavirus was in New York City long before the government was starting to mitigate that issue by having people stay at home or doing the cleaning efforts that they were doing in New York City subways, that the coronavirus was in the city and spreading so rapidly. That's why we're seeing these military-style hospitals being set up, these field hospitals in Manhattan Central Park, a very famous park in New York City, now is the site of a field hospital where they've set up tents and beds. And this is something that we saw in coastal states, Washington State, where the city of Seattle is, California, San Francisco had a bad outbreak there, in New York City, but it's starting to move inward into the Midwest and the Deep South. Now seeing hot spots in Chicago, in Michigan, and in Louisiana. Ash?
The race is on, of course, to try and manufacture more ventilators. We know medical supplies are running short across the US. Where is the government at procuring some of those supplies?
Yeah, this is a cry that we've heard from so many governors, especially the governor of New York and New Jersey, asking for more ventilators. We saw the governor of New York using his hand and pumping a manual ventilator because that's what some of the doctors in the facilities have to do now to try to keep people alive, to try to keep them breathing when they have the coronavirus. And so right now we know that President Trump says that there are about 10,000 ventilators in a federal warehouse somewhere that he will not release to those governors, to the states, saying that he wants to hold on to them until we reach the peak of the pandemic. And that goes completely against what governors are saying they need. And we're hearing from hospital workers, from doctors and nurses who are telling us that they don't have enough masks, they don't have enough ventilators, they don't have enough PPE, personal protection equipment, so that they can go and do their job safely. And unfortunately, we're seeing doctors and nurses with confirmed cases of the coronavirus, even dying from the coronavirus, and they're linking that to their lack of PPEs. So you're seeing a disconnect between the federal government, the state government, and those folks who are working on the front lines of fighting the coronavirus right now. So we have seen private industry, the private sector stepping up. An automaker in Alaska who has stopped making cars, but instead making face masks from using some of the same material they would use for the windshield or the plastics and metals there, and making those face masks. We see fashion designers all over New York City stitching together face masks for those doctors and nurses because, in their opinion, the federal government has failed them in giving them the protection that they need so they can go into those hospitals and those clinics and treat people who have the virus.